So what is exactly in your cannabis? Did you know that there's actually over 150 cannabinoids within a cannabis plant? And even besides that, there's over 500 other different natural compounds. And that would be found in both of the indica sativa or, as we learned, hybrid. So some examples of cannabinoids that you're certainly familiar with would be THC and CBD, for example. But again, remember, those are only two out of over 150 that have been discovered. So THC and CBD are known as major cannabinoids. So what is THC? Well, it's got a big old name, delta 9 tetrahydrocannabinol. I can't even hardly say it myself. But THC is actually a chemical. It's a cannabinoid that is found in the cannabis plant. And it's responsible for most of the psychoactive effects that you may experience if you use cannabis at all. Even if it's used medically or recreationally, there's typically going to be some THC in there. We'll talk about that in a minute, why that would be. But it is responsible, THC, for the intoxicating effects that can be brought on. So, what is THC even used for? Well, one of the things it's used for is for, and again, primarily symptoms and side effects of these things, but neuropathic pain. It also has been clinically proven to reduce nausea and vomiting, especially in particular when it's chemo-induced. It's also known to be an appetite stimulation, good for appetite stimulation, and also for sleep apnea. It can be really, really good for insomnia and fibromyalgia. So it's also really good to help you get to sleep and then keep you to sleep. It's good for neuropathic conditions and also for muscle spasticity that's seen in MS. One way I find it easiest to explain THC is that if you look at it on this scale. So at the very bottom of this scale is what hemp would be. So anything under 0.3 would be considered hemp in a plant, in a cannabis. So if you see a hemp plant, for example, as long as it has under 0.3% THC, then it's considered hemp. But anything above that is considered cannabis. So, but if you look at that scale in terms of like the higher you go up the scale, the higher you will be. You will have, without a doubt, more anxiety, you will be more disoriented, and you will feel more intoxicated. So again, when you see these percentages, you can see as they go higher, that is where people end up finding that they have more difficulty with it. So one thing that is important to keep in mind is that the medical side of things seems to be sort of in this realm, except for maybe chronic pain and sleep. We could even go up here. But then the recreational side seems to be focused more there. So that's just one way to kind of look at it.